Have you heard about abnormal psychology?
Yes, it's a subfield of psychology that focuses on the study of atypical or abnormal behavior, thoughts, and emotions.
That's right. Abnormal behavior is typically defined as behavior that is statistically rare, deviates from cultural or societal norms, causes significant distress or impairment in functioning, or poses a risk to oneself or others.
I see. How do psychologists diagnose and classify psychological disorders?
They use diagnostic criteria and classification systems to identify and categorize psychological disorders. One of the most widely used classification systems is the Diagnostic and Statistical Manual of Mental Disorders, DSM, published by the American Psychiatric Association.
Interesting. What about the causes of psychological disorders?
Abnormal psychologists study the biological, psychological, and social factors that may play a role in the onset of these disorders. Understanding the causes can inform treatment approaches.
How do psychologists assess and diagnose psychological disorders?
They use a variety of assessment tools, such as interviews, questionnaires, and psychological tests, to make accurate diagnoses.
What are some approaches to treating psychological disorders?
Different approaches to treatment may include psychotherapy, medication, and various forms of rehabilitation and support.
I see. What about research and study in abnormal psychology?
Abnormal psychologists conduct research to expand our knowledge of mental health conditions and their treatment. This research can involve clinical trials, experiments, case studies, and epidemiological studies to better understand the prevalence, risk factors, and effective interventions for psychological disorders.
What about ethical considerations in abnormal psychology?
Researchers and clinicians must adhere to ethical guidelines to ensure the well-being, privacy, and informed consent of individuals with psychological disorders. This includes issues related to confidentiality, informed consent, and minimizing harm.
That's important. What about reducing the stigma associated with mental illness?
Education and awareness campaigns aim to promote understanding and compassion for individuals with psychological disorders, ultimately reducing discrimination and improving access to care.
I see. How has the study of abnormal psychology evolved over time?
In the past, individuals with mental health issues were often stigmatized and subjected to inhumane treatments. Modern abnormal psychology emphasizes a more compassionate and evidence-based approach to understanding and addressing mental health challenges.